Lots of different things respond to paralyzing muscles. Lots of different things respond to restoring volume that's been lost. Okay, welcome to this edition of the Wise Medical Minute. I want to talk a little bit today about injectables. Now, what do I mean by injectables? Aesthetic injectables in particular are usually things that we inject into, most often, the face. But I've been asked to address some of the more creative uses for injectables. Let's talk concept for a minute. The botulinum toxin, Botox-like drugs, Botox, Dysport, Xeomin, and there's another one, Juvo. All these are botulinum toxins. They all work by paralyzing the muscles of expression, or paralyzing wherever you put them. That's what we're going to get back to. Literally relaxing the muscle so that when it is attempting to contract, it doesn't contract, and the wrinkles that result from that contraction are therefore reduced. Now, we talk about fillers. These injectables are intended to restore volume, okay? So there are times when the volume is the issue. There's times when the wrinkles are the issue. We've had some really good results lately using both for the kinds of reductions in aging-related appearances that people don't like. Now, I want to use an example of the virtues of combining both the toxin, which paralyzes the muscle, and the filler, which restores volume. When a muscle's been contracted down hard enough, long enough, the wrinkles tend to be more static and not dynamic. Dynamic wrinkles come and go. Those are the ones where the toxins work the best. Static wrinkles are the ones that don't go away when your expression changes. So those tend to be more appropriately addressed with filler. So in the example you see, we'll have a good demonstration here of how you can combine both filler and relaxing the muscles that cause the wrinkle in the first place, and literally make a pretty deep wrinkle go away. Now, another creative use for the toxins has to do with the reshaping of the face. Now, a lot of people are born with really prominent jaws. Sometimes it makes the whole face round, and they prefer, for reasons I don't understand, and it doesn't matter, they want to have a more long oval appearance to the face. One of the ways we can accomplish that is to relax the masseter muscle, which is the muscle that gives the jaw its prominence and makes things look more square. When you relax that muscle, you get an elongation of the face, but the art to achieving a more elongated oval instead of a square look is not to do too much. Now, the advantage is a serial approach of mounts that we won't bore you with, of units of the botulinum toxin, or Dysport works as well or better, in the muscle itself, each week putting a little bit more until the elongation of the face has been achieved. So for people who are very often Asian descent, I've had a run on people from Brazil, and people of all nationalities sometimes when they have a square that they want to make more oval, relaxing that masseter muscle with serial injections of the toxin works beautifully. Another creative use that's become quite popular, and I've had some good results, is using the hyaluronic acid fillers, not just for wrinkles, but they're enhancing the lips. I don't know why that's got to be so popular, but it's actually kind of gratifying for these ladies. They want to make their lips more prominent. We can create more definition in the vermilion border, but mostly restoring the volume and increasing the shape. And this is especially a concern with people who smoke their lip volume is reduced. And combining, once again, relaxation of the muscles in the orbicularis oris and restoring the volume, that's the combination of the toxin and the fillers that gives you the optimal results. Now, we've also had, almost as a side effect, good response in people who have really prominent forehead wrinkles, and we aggressively relax that frontalis muscle. They mysteriously observed that headaches got better. So the Botox people were creative enough to get an indication for treating migraine headaches with Botox. In my opinion, the headaches we're treating are not really migraines, but muscle contraction headaches. By definition, it makes perfect sense that even though people use the term migraine as synonymous with severe, true migraine is a vascular phenomenon. It makes no sense that Botox should work. But the muscle contraction headaches that respond to relaxation of the muscles, it makes perfect sense that the Botox would work. So we've had good luck with Dysport, good luck with Botox. I haven't used Xeomin for headaches yet. I haven't used the Jeuveau yet, but one of these days we'll try those as well. I don't see why it should make a difference which product for that particular indication. Last but not least, we've had some recent calls and a little bit of experience with using the hyaluronic acid fillers for the so-called OShot. Now, I can't use that term because I haven't paid for the franchise fee, but when you want to enhance the female sexual response, there is a spot in the so-called OShot that you enhance with volume, and that increases the friction within the vagina during sexual intercourse. Now, I was amazed at how simple a procedure has had such amazing results. But there's a new creative use for filler that people don't often talk about. So, you know me, somebody's got to say it. So anyway, the idea being Botox and the fillers are not just about the 11s and not just about the crow's feet anymore. The fillers and the botulinum toxins can be used for multiple aesthetic and other physiologic purposes, like hyperhidrosis. We'll talk about that more in a future video when I get a little more experience with it. But lots of different things respond to paralyzing muscles. Lots of different things respond to restoring volume that's been lost. So that's the basic concept behind all of the botulinum toxins and the fillers, and we'll do more on this as questions arise. I encourage you to submit your questions to info@wisemedicalcenter.com, and I'll address your questions in a future recording. Thanks for your attention.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.